So our topic is on certain diseases which are more common due to people's ethnicities across the globe, or even people who have migrated to the UK. So people of Afro-Caribbean are at a higher risk of getting diabetes than the European population. For example, the risk could be 14 to 20% among South Asian, Chinese population, Arabs, then compared to 3 to 10% of just Europeans. And this could be due to sedentary lifestyle, diet, unhealthy diet, and lack of and obesity. So also ethnic minorities who experience malnutrition while they were growing up can lead to glucose dysregulation and development of type 2 diabetes. Then we'll move on to stroke. So the risk of having a stroke is much higher or double for blacks than for white population. It's also 1.5 times higher risk in South Asians compared to the white community. The blacks have the higher rate of mortality due to stroke as well. And we looked at some figures here and some diagrams. Then we'll move on to cardiovascular disease. So there's a 60% greater cardiovascular health disease death mortality rate in South Asians than in Europeans. 6.8% of South Asians compared to 4.4% Europeans had an atherosclerotic cardiovascular event done in a study. And the risk factors are again having very high blood pressure, hypertension, diabetes, central fat tissue, adiposity, and you can see the probability of having a heart attack early early on in age is much higher than other countries, and this could be due to the ancestry, the background, ethnic group, gender, and again those risk factors I mentioned here and before. Thank you. These are just sources.